Hi, my name is Rachel Ward and I'm a student at University of Mary, and today I'll be demonstrating a wet to dry wound dressing. Before I go into the room, I check the chart to make sure I have the right patient, that this is the right time to be applying the wet to dry dressing. I'm going to knock on the door. Hi Adam, my name is Rachel. I'm going to be your student nurse today. Can you please verify your name and date of birth for me? 7/25/1966, Adam Brown. Thank you very much. Alright, Adam, and what's your pain level at right now? About 2 out of 10, that's good. We made sure to give him a pain medicine about 30 minutes to an hour ago to make sure that his pain would not be at a level that was unbearable for him during this procedure. Alright, Adam, I'm going to go wash my hands and get my supplies, and I'll be right back for this procedure, okay? Alright, I'm going to get all my supplies ready now. And first I perform hand hygiene as well. Get my biohazard bag ready. Alright. And I'm just going to expose your wound here. Grab a towel. Alright, and initially looking at it, you want to observe if there's any drainage, noticeable bleeding, because those are abnormal things that you'd want to report right away, but we see nothing here. And I just need clean gloves for removing the old dressing. Alright. Let me know if there's any tugging, Adam. Alright, and we'd note that there's no fluid on the external gauze, which is good. I'm going to take off the dry gauze next. There's a little bit of fluid on here, but it's serous, so that's good. That means that it's healing. Alright, now this might tug just a little bit, but it shouldn't be too bad. Okay, and now I'll examine the wound and see that there's no swelling, edema, excessive redness, and that there is granulated tissue, which means that it's healing, which is good. So now I can take these gloves off. And then I perform hand hygiene again, and then start preparing my sterile field here. I'm going to start with my tape first, actually. Alright, looks good. I'm also going to check my fluid, make sure the date on it is correct, it's not expired. Alright, looks good. And I'd also make sure that I have an assistant in the room because I'll need help with Q-tips here in a minute. And I can put on my sterile gloves. Alright, looks good. Before I put on my sterile gloves, I would have poured this onto the gauze to wet them. So let's do that now. Looks good. I'll grab my first one. Keeping my hands above waist level. I'm going to go from least contaminated area to most contaminated. you doing, Adam? Good to hear. Nice down the middle. Alright, and now I'm going to have my assistant come over and hand me a Q-tip, please. Thank you. You know what I'm missing? Pause that for a second. Okay, so with my first Q-tip, I'm just going to measure the wound here. Check it for length first. Alright, that one's about 18. I don't need a Q-tip each time, do I? It's okay. Alright. And the width. It's about 4 centimeters. And the deepest part of the wound. About 4 centimeters as well. Awesome. I'm going to grab one more Q-tip here. And now I'm just going to probe around the edges and make sure that there's no tunneling in the wound. Alright, and his is healing really well, so there's nothing going on here. Alright, awesome. Now I'm going to start grabbing my wet gauze and unfolding it. And grab it, please. Thank you. Alrighty. We're going to pack this down into here and try to avoid touching the skin because the skin is still contaminated. I'll probably use one more here still. Another time I didn't happen. Alright, and now it looks about flush with the skin, so the wound is full. Good. Alright, looks good. Now we're going to come over here to the dry gauze. I'm going to take 2 and just place those over here. And then we're going to grab our large ABD, making sure not to touch the inside of it and keep it sterile. Alrighty. Alright, and when I'm done with this, I'm going to remove my gloves here. And then I'd have a marker with me and I'd write the date and time, my initials on the dressing so that the next nurse could come in and could verify what time it was done at and that they can do the next change. Alright, we're going to clean you up here and I'll clean up my station. How did you tolerate that procedure, Adam? Any pain? No, that's good. Alright, we're going to lower your bed again here. Just kidding, it's already in the lowest position. Good. Alright, and then I clean up the rest of my area and I'd go chart any fluid that was draining out of it and the content of the fluid, if it was cloudy or clear or if it had any odor to it. I'd also document that there was granulated tissue to make sure that everyone knew it was healing well. And I would report any abnormal occurrences such as excessive bleeding, swelling, or edema. And then I'd perform hand hygiene, provide privacy again, and leave the call light, and I would finish my procedure.